Hi there, and welcome back. Let me ask you something. Have you ever wondered if signing up for Medicare while you're still working is really necessary? Or maybe you've heard conflicting advice from friends, your HR department, or that one neighbor who thinks they're a Medicare expert because they read an article once. You're not alone. This is one of the most common questions I hear from people approaching 65. It can feel like a high-stakes puzzle. Should you enroll? Should you wait? And what happens if you choose wrong? I'm Carrie Buckley, and you've landed on Mastering Medicare. Make smart choices with zero confusion. If you're approaching 65 or already enrolled, you know Medicare can feel like trying to read a user manual written in ancient Greek. That's where we come in. Here at Mastering Medicare, we break it all down, simple, straightforward, and without the jargon. From understanding when to enroll and what each part covers, to comparing plans and avoiding penalties that can cost you thousands, to knowing exactly what steps you need to take so you feel prepared and protected. We cover everything you need to know. Subscribe to Mastering Medicare and let's take the guesswork out of Medicare together. Today we're talking about a decision that could have a big impact on your healthcare costs and coverage. Should you enroll in Medicare if you're still working or stick with your employer plan? Let's break this down step by step so you can make the choice that's right for you. First, let's set the stage. If you're approaching 65 and you have health insurance through your or a spouse's current employer, you might not need to sign up for all of Medicare right away. But, and this is a big but, there are some rules, exceptions, and important timing considerations you need to understand. Let's start with Part A. Part A is hospital insurance. If you or your spouse have worked at least 10 years or 40 quarters and paid into Medicare taxes, Part A is typically premium-free. Should you enroll in Part A even if you're working? For most people, the answer is yes. It can serve as secondary coverage to your employer plan and help pay for some costs if you end up hospitalized. However, there is one exception: if you're contributing to a health savings account or an HSA. Once you enroll in any part of Medicare, including Part A, you can no longer contribute pre-tax dollars to your HSA. If you want to keep funding your HSA, you'll need to delay enrolling in Medicare altogether. This surprises a lot of people and can create headaches at tax time, so be sure you're clear about your goals with your HSA. Now let's talk about Part B. Part B covers outpatient services like doctor visits, preventative care, and some medical equipment. Unlike Part A, Part B has a monthly premium. In 2025, the standard Part B premium is $185 per month, and higher if your income exceeds certain thresholds. Should you sign up for Part B if you're still covered by an employer plan? Well, here's where the employer size matters. If your employer has 20 or more employees, your group plan is considered primary coverage and Medicare is secondary. This means you can choose to delay enrolling in Part B without a penalty as long as you remain covered by your employer plan. Now, you do need to confirm this with your HR department to make sure that if it is a large group employer, that they allow you to defer Part B. If your employer has fewer than 20 employees, Medicare becomes your primary insurance, and your employer pays as secondary. In this case, you must enroll in Parts A and B when you're first eligible to avoid gaps in coverage and potential penalties. A lot of people assume their employer plan is always primary, but that's simply not the case with smaller employers. Here's a quick example to illustrate. Meet Susan. She's 65, still working, and her company has 15 employees. If she doesn't enroll in Medicare Part B, her employer insurance will only pay secondary. That means most of her medical bills won't be covered at all. You definitely don't want to get into that situation. So, if you work for a small business, enrolling in Medicare when you turn 65 isn't optional, it's essential. What about Part D prescription coverage? If your employer plan includes creditable prescription drug coverage, which means it's at least as good as Medicare's standard plan, you can delay enrolling in Part D without a penalty. Your employer should send you a notice each year confirming whether your drug coverage is creditable. Keep this document for your records. If your drug coverage is not creditable and you don't enroll in Part D when you're first eligible, you could face a late enrollment penalty later for as long as you have Medicare. And trust me, that penalty is the gift that keeps on giving. When might it make sense to enroll in Parts A and B right away? Well, if your employer plan has high premiums, deductibles, or limited coverage, if your employer has fewer than 20 employees, if you prefer Medicare over your employer insurance, and if you don't need to keep contributing to an HSA. It's all about comparing coverage and costs. Sometimes Medicare is simply a better value, especially if your employer plan is pricey. Here's a note about timing. When you eventually retire or lose employer coverage, you'll get an 8-month special enrollment period to enroll in Part B without a penalty. But be careful. COBRA and retiree coverage don't count as active employer coverage. If you retire and elect COBRA, your special enrollment period starts when your employment ends, not when COBRA ends. This trips up many retirees, and the result can be permanent late enrollment penalties. If you're enjoying this, make sure you subscribe to Mastering Medicare so you'll always have clear guidance to make smart Medicare decisions. Here's a few common pitfalls to avoid. You shouldn't assume that your employer plan is always creditable. Verify it in writing. Delaying Part B if you work for a company with fewer than 20 employees is not the road to go. Forgetting that enrolling in any part of Medicare stops your ASA contributions, and missing your special enrollment period after employment ends. So how do you make the right choice? Well, start by comparing the costs of your employer coverage with the costs of Medicare Parts B and D. Look at monthly premiums, deductibles, out-of-pocket maximums, and prescription coverage. Also, factor in whether you still want to contribute to an HSA. If you're unsure, this is exactly where working with an experienced Medicare professional can save you money, time, and stress. So let's quickly recap so you feel clear and confident. With Part A, it's usually premium-free, and most people enroll at 65 unless they want to keep contributing to an HSA. Medicare Part B, you can delay enrollment without penalty only if your employer has 20 or more employees and your coverage is creditable. For Part D, which is prescription drug coverage, you can delay enrollment if your prescription coverage is creditable. If your employer has fewer than 20 employees, you need to enroll in Medicare Parts A and B when you turn 65. When your employment or employer coverage ends, you have an 8-month special enrollment period to sign up for Part B without a penalty. Always verify your employer coverage in writing and compare costs carefully before deciding. Remember, navigating this isn't something you have to do alone. With the right information and support, Medicare doesn't have to be confusing or stressful. Thank you for watching today's episode. If you want to feel confident and informed about Medicare and your healthcare strategy, subscribe to Mastering Medicare now. And don't forget to hit the notification bell so you'll be the first to know when we release fresh insights to help you protect your health and your wallet. Have questions or want to share your thoughts? Leave a comment below. We read every one. If you'd like more one-on-one guidance, you can also schedule a complimentary 20-minute discovery call to get your questions answered and learn which strategies may be right for you. Just click the link in the description to pick a time that works best.